This Insta lecture session would be on MSRCT, malignant small round cell tumors. We are going to know what are malignant small blue round cell tumors, also known as blue round cell tumors. What are the common examples of malignant small blue round cell tumors? Why we call them malignant small blue round cell tumors, and what's the significance of knowing them as malignant small blue round cell tumors? This is a common term which you are going to get in oncology and oncopathology, particularly in the pediatric oncopathology. Essentially, this MSRCT, malignant small blue round cell tumors, are tumors which are common in children and adolescents, and their biopsy appearance are similar. This group of tumors, they have a common biopsy appearance. That biopsy appearance is this, that they appear, most of these tumor cells appear as small blue round cells on the biopsy. Why we call them blue cells, also known as blue cell tumor? Because normal cells, in normal physiological state, actually the cells have 1:6 or 1:4 to 1:6 nucleocytoplasmic ratio. That means cytoplasm is much more compared to nucleus in a normal cell. For one volume of nucleus, there should be 4 to 6 volume of cytoplasm. But you know that in cancer cells, the nucleus becomes larger. And particularly in this group of tumors, the nucleus becomes the key portion of the cell. The nucleocytoplasmic ratio becomes heavily tilted in favor of nucleus, because the cells of malignant small blue round cell tumors, they are mostly made with nucleus with a very scant or little amount of cytoplasm. Now, when you look at a normal biopsy, normal slide, mostly it appears pinkish, because most of the cells, they have a lot of cytoplasm, and cytoplasm usually have eosinophilic, pinkish appearance in layman's term. But in these tumors, those tumors are mostly made with cancer cells, and the cancer cells are mostly made with nucleus. The nucleus normally appears bluish, because in hematoxinosis stain, the usual stain. So that's why the whole tumor, their biopsy appearance, they look very much bluish, and that's why you have given the term small blue round cell tumor or blue round cell tumor. This is also another term. Next thing you need to know, that what are they basically? They are a very highly aggressive group of tumors or malignant tumors or cancers which are common in young kids or children, and we see them mostly between newborn period to up to 20 years of age. And these tumor cells are essentially made with a lot of primitive undifferentiated looking cells which are appearing small blue round cells. And the common examples of malignant small blue round cell tumors are neuroblastoma, retinoblastoma, Ewing sarcoma, medulloblastoma, Wilms tumor, rhabdomyosarcoma, and lymphoma. These are the common examples, common notable examples of malignant small blue round cell tumor or blue round cell tumors. Now, I'll give you some examples on how this is going to help you to make a diagnosis. For example, if they gave you a case study where they're saying that in a mother notes in her 9-month-old baby that there is a palpable abdominal mass is there, and the baby, the urinary vanillin mandelic acid or homovanillic acid level is elevated, and representative biopsy section, and there's a and CT scan shows or radiography shows that there is a mass arising from the adrenal, they say. That means radiologic study shows that the tumor mass is mostly arising from the adrenal. And the representative biopsy section, they are showing that the tumor is made with small blue round cells, and there is presence of homarite rosettes, and there is presence of neuropathy. What's your diagnosis? So these are typical, and they can sometimes give you some more clues, that there is a raccoon eyes, there is a periorbital hemorrhage in that baby, there is a muffin baby appearance, there is a lot of skin metastasis has occurred that has created a blue muffin like appearance. So this is a typical presentation they can give you for neuroblastoma, and neuroblastoma is a classic example of small blue round cell tumor. And neuroblastoma is basically a tumor which originates from neural crest cells in the sympathetic chain or in adrenal medulla, and they're mostly made from undifferentiated neural crest cells, and particularly they're common in the first 5 years of the life. And they're the most commonly we see them in the infancy period. They're very common cancer in the infancy period. Similarly, they can phrase a question or pose a question stem for you, that a 12-year-old boy is presenting with a painful bony mass in the lower end of the femur, which is shown radiographically, that there is expansile mass in the diaphyseal region, basically to say diaphysis of the femur, and the corresponding biopsy section is showing presence of a lot of monomorphic small blue round cells, and the tumor cells are positive for translocation 1122. What is your diagnosis? This is a case of Ewing sarcoma, and again they are using that catchphrase small blue round cell tumor, because Ewing sarcoma is a classic example of small blue round cell tumor. In the same manner, they can ask you that it's an intraocular malignant tumor seen in a young kid, and the tumor cells are appearing small blue round cells, and there's a presence of flexner intestinal rosette seen in biopsy. What's your diagnosis? It will be retinoblastoma. So small blue round cell tumors are very common, particularly for the pediatric tumors, and these are very highly aggressive tumors which are seen in children. So I would make a few more Insta lecture on this topic, that is malignant small blue round cell tumor. And just to have a quick recap for this session, malignant small blue round cell tumors are a particular group of highly aggressive cancers seen in children and adolescents, which on biopsy have a similar appearance. The tumor cells shows a primitive undifferentiated appearance with malignant small blue round cells, and they are bluish because the tumors are mostly made with nucleus with very little amount of cytoplasm. That's they have this bluish appearance on the biopsy. And the common notable examples I have given: neuroblastoma, retinoblastoma, Ewing sarcoma, rhabdomyosarcoma, particularly embryonal variant of the rhabdomyosarcoma, lymphomas, and all this. So these are the few key points that you must remember about malignant small blue round cell tumors and small round cell tumors. Thank you very much.